Today, we have Lisa, a potential participant who is attending the initial visit for a Phase 3B pharmaceutical research study for a medication for the treatment of opioid-induced constipation. The research coordinator, Jennifer, will present the informed consent form to the patient for review and discussion. Janet Bull, the PI, will present after the patient has had an opportunity to review the consent form to answer any questions and provide additional information. The participant will make a decision to participate in the study and completes the informed consent process.
Thank you for taking the time to meet with me today. I'm Jennifer, the study coordinator.
Hi, nice to meet you.
This is the consent form for the opioid-induced constipation study that we talked about over the phone. We'll also review the attached HIPAA consent form too. The purpose of an informed consent is to give you all the information you need to decide whether or not you want to participate in this study. You don't have to make a decision today, and we encourage you to go through this information with your friends, family, or doctor before making a decision. Would you like to have some time to read through it before we go over each section together?
I think you can just go over it with me.
Okay. The purpose of this research study is to find out how effective and safe a new experimental drug is.
That was a lot of information. It's kind of overwhelming.
It is a lot of information. We want to make sure that you have all the facts you need to decide whether you want to participate. Did you have any specific concerns or questions about anything that you read?
Well, I'm a pretty busy person, and so how much time is involved with this program?
Well, each visit lasts about an hour, and we try to schedule them approximately every 2 weeks. We'll try to make it as convenient as we can for your schedule.
Okay. What did they mean by qualify?
Each clinical study has a specific set of requirements that patients have to meet. We'll look through your medical history, lab test information, and other test results to determine if you meet that criteria. If any of your labs or other information we get determines that it's not in your best interest to continue, Dr. Bull wouldn't let you participate even if you wanted to. During the study, if your health were to get worse, if you were to have a problem with the study drug, or if Dr. Bull determines it's not in your best interest to continue, we would end your participation early. And of course, you're a volunteer. You don't have to choose to participate in this study. Or if you do choose to participate, you can end your participation at any time for any reason. We're happy to discuss all of your options with you so that you can make an informed decision. Did you have any other questions?
Yeah, I'm not quite sure what placebo means.
Well, let's review that section again. The study will test between 2 different doses of the study drug and a dummy drug called a placebo. A placebo looks and tastes exactly like a study drug, but contains no active ingredients. Now, so I know I've done a good job answering that question, can you tell me a little bit about what we've just reviewed?
Well, a placebo is a tablet with no active drug in it, but it looks and tastes like the study drug, but neither you or I will know if it is the real drug.
Right.
So why would they give me a placebo? I mean, don't they want to know if this drug works?
Yes, they do want to know how it works. In this type of research, participants are randomly assigned to different groups. 2 out of every 3 patients in this study will receive active drug. At the end of the study, the sponsor will look at all the information from the patients that took the drug and compare it against patients who didn't take the drug. That way they can see how effective the medication was for people. This is the biggest reason why those diaries we talked about are so important.
Oh, I understand. So what if they find out it isn't safe? I mean, it is a research drug, right?
Well, sometimes during the course of the study, new information does become available. If that happens, we'll discuss any findings that we have, and we'll decide whether or not you want to continue in the study. Your safety is our main concern.
Well, that's reassuring. I sure hope it works.
We do too, but you understand we can't guarantee that it will work for you.
I understand.
Lisa, I'd like to go and get Dr. Bull, the doctor who's in charge of this study, to come and meet with you. Please feel free to ask her any questions or discuss any concerns that you may have about the study.
Okay.
Be right back.
Hi, Lisa. My name is Dr. Janet Bull. It's so nice to meet you.
It's nice to meet you too.
I hear that you and Jennifer have been discussing the study, but I always like to come over, meet with patients myself, and check for understanding and answer any questions that you may have.
Okay.
I was reviewing your chart and noticed that it seemed like your constipation got worse ever since you started your pain medication. Can you tell me a little bit more about that?
Yes, it's been pretty bad, especially since they increased my pain medications. At most, I can go twice a week, and that's using Forcena twice a day. And sometimes I have to use an enema, which I absolutely hate. And it's just a really uncomfortable, embarrassing problem.
Sounds like it's caused you a lot of distress.
Yes, it has. And I like the idea of the study, but I'm wondering if I'll get the real drug.
Well, there's a possibility that you may not get the real drug and get a placebo. It looks like the real study medication, but it doesn't have any active ingredients in it. There is, however, a 2 out of 3 chance that you'll get the real study medication. After the first phase of the trial is the extension phase, and during that period, everybody gets the real medication.
How will I know if I got the real drug?
Well, you won't, and neither will I. That's why we'll be monitoring your bowel movements really closely.
Jennifer mentioned this isn't the first time that this drug's ever been used. So can you tell me a little bit about the results that other people might have had? Because quite honestly, I'm a little worried about the side effects.
Sure, there were 2 previous studies with this medication. About 60% of the patients had a bowel movement within 24 hours. The most common side effects that were seen, as you've read in the informed consent, were abdominal cramping and bloating, diarrhea, and dizziness. These occurred in less than 10% of the patients. There were no serious side effects seen, but that's why we're doing this study. It's got 400 participants, so we'll get a better idea of how the drug works.
Well, I would try anything to get relief from this problem.
It sounds like it's been a real problem, Lisa. Know that while this medication may or may not benefit you, the results and the information that we gather from running this study will certainly help other people who suffer from constipation.
Okay.
As your study doctor, I'll be reviewing your lab work, monitoring you really closely. That's why it's important if you notice any change in your health status, a new symptom develops, a change in medication, that you contact either Jennifer or myself, even if you don't think it's related to the study medication. Being in a research study is different from standard medical care. The purpose of this study is to monitor the effectiveness of the drug, to see the impact on your quality of life, and to make sure it's a safe drug. In no way will this interfere with your regular medical care. You'll still be seeing Dr. Hill for your oncology appointments.
Okay, well that sounds good. Now, will you be in contact with Dr. Hill? Because I really don't want to do anything without his approval.
Sure. I've actually already contacted him, and he thought you would be a good participant for this study. I'll be keeping him in the loop. Any changes that you may have in your health or any abnormal lab values, I'll be contacting him.
I understand. So will you be the doctor that I see during the study?
That's correct. I'll be doing the majority of your visits and your physical exams.
Okay, that sounds good. So how do I get in touch with you if I have a problem or an issue and I don't have an appointment coming up?
On the front page of your informed consent is contact information for both Jennifer and myself. You can call us 24 hours a day.
Okay.
Lisa, one thing that I go over with all study participants, I want you to know that you can withdraw at any time for any reason and it won't affect your regular medical care. This is voluntary and we really appreciate your participation. Do you have any other questions for me?
No, I don't think so. I think all my questions are answered. And I'd like to go ahead and participate.
Great. Well, I'll have Jennifer complete the informed consent process and I'll plan on seeing you next week.
Okay. Well, thank you so much, and I'm really hoping this will work for me. But if not, I'm really glad to be of help to others.
Great. Well, it's so nice to meet you. We'll take really good care of you.
Thank you.
Thank you. Well, thank you for deciding to participate. I'll let you begin initialing and dating each page of your consent form. Now, by signing the consent form, it means that you understand the study, that you've been given the opportunity to have all of your questions answered, and that you don't have any concerns about that. You're confirming that you would like to participate in this study, but know that you're not giving up any of your legal rights by signing that form, and that you can voluntarily leave the study at any time for any reason.